My feel-good breakfast show.
A very warm welcome back on the 1st of December, World AIDS Day, and it encourages communities around the globe to share a spirit of hope and strength for those living with HIV and AIDS, and of course commemorate the loved ones who have lost their battles to AIDS. But the fight must certainly continue, where innovations in HIV healthcare contribute to better standards of life for those enduring the HIV treatment, and many of these successes are happening right here in Mzansi.
Some of the world's greatest wars are being fought down a microscope. With HIV and AIDS, the road to winning the battle begins with finding practical solutions for prevention and current treatment.
It's ongoing innovation in antiretroviral treatment that aims to give people living with the disease a chance at a dignified life. Even though we have come a long way with ARV rollout, we still have much work to do. So what are the exciting developments in this field, and what are the challenges?
The Right to Care Centre is an NGO support facility based at the Helen Joseph Hospital in Joburg. It brings the results of extensive HIV research and governance straight to those in need of treatment, and was co-founded by Professor Ian Sanne, who is at the forefront of ARV research in South Africa.
So, Professor, antiretroviral drugs are essential to survival of people with HIV, but what exactly are they?
So these are medicines that we've developed over quite some time. Usually taken 3 different types of medicines for the treatment of HIV. Once people start treatment, they need to stay on treatment lifelong.
These recent changes to ARV rollout mean that more people will be able to get them, but what are our challenges that are prevailing that prevents people from getting access to them?
The South African treatment program is now the largest in the world, with over 3 million patients on treatment. But we have to go and double that. We're trying to develop differentiated models of care to move patients from the hospital setting first into primary healthcare, but then into alternative settings of treatment. My research group is working hard to try and actually do that.
All patients with HIV in South Africa can receive ARV treatment from the government, but access remains a challenge. So it's at overcoming socioeconomic barriers and issues of practicality where innovation is needed.
We found that patients were waiting in pharmacy queues for over 4 hours a day. So in a move to try and automate that, we developed data systems and more recently pharmacy automation. In part, we do this for the hospitals, and in part, we're now doing it for what we call patient dispensing units to move out into the community through what is almost like an ATM. We're focused on the public sector. So 70% of patients receiving their medicines through normal clinics. We would like to offload those clinics to actually provide the treatment through these patient dispensing units.
This kind of forward thinking resolves many accessibility issues, so the next stop is growing government and community support through education and awareness.
Professor Thenji, the success of medication is not just a medical issue. We still need various bodies, from communities to our government, to come to the party to make sure that people are well aware about HIV and getting treatment. What are the things that we have to work on to make this happen?
One of the things that HIV has taught us is that people, if you just tell them why they're taking the tablets and treat them like rational, intelligent human beings, they will take their tablets. Actually getting the tablets into their mouths is only a tiny component of it. Trying to create the social context where they can get to the clinic, pick up the tablets, take them home, all those things in many ways are actually far more difficult to solve. The stuff that I work on in my research programs, which is to make the tablets safer and more robust and cheaper and smaller, actually is relatively small fry compared to the bigger social problems.
Professor, I know it's a tough question to ask, but realistically, when will all of this be over?
So I don't think it's going to be over in our lifetime. I think the cure, there's interesting work happening there, but it's probably a generation or 2 away from being practical and something we can implement. But I think we're living with a generation that is going to be medicalized. We have seen that in many societies, actually people with HIV are living longer than HIV negative populations because they're in the clinic. You know, they get yelled at about not smoking, about exercising, about getting their pap smears and their blood pressure sorted out. We've nailed the medical side of things. First prize is preventing new infections. Second prize is doing what we're doing at the moment, which is providing safe and effective medication that makes you get on with your life and live a normal life.
It's important that we make our communities well aware of the fact that treatment can lead to a long and full life even if you have HIV. But of course, it's only once we completely eradicated all new infections that we've won the battle.